Some people call Virgilio Licona a rabble-rouser, but his persistent activism dramatically improved the availability of quality health care for Colorado's minority communities.
He truly was a larger-than-life character.
Dr. Tillman Farley at Salud Family Health Centers remembers Licona as an amazingly charismatic, dedicated, and passionate doctor. In an interview for a documentary with Down to Earth Media, Licona described how his outlook was shaped by growing up in South Texas.
Discrimination was not only legal and accepted socially, but it was a norm.
In the 1960s, Licona got involved in the anti-war movement. He learned that through commitment, change could be made. He moved to Rocky Ford and started a food bank. That's where he was exposed to the inequalities in health care.
If you went to the hospital and wanted to get services, you could be refused services if you did not have money.
Insurance wasn't there. I mean, it's like most families didn't have insurance.
Rick Vigil produced the documentary on Licona. He talked with Roberta Macias, who remembers Licona's political struggle, trying to start a family clinic in Rocky Ford in 1973.
He wasn't only an outsider, he was a rebel-rouser. He was a radical. And no, you don't want to bring those kinds of people here and their ideas and their vision.
He ran into roadblock after roadblock.
He could have easily said, I don't want to deal with this, but he didn't. He was committed.
Now, private nonprofit community health care centers are a big part of health care in Colorado.
His legacy really is that you can't work in this field without feeling his impact every day, really.
Lance Hernandez, Denver 7.
If we can teach the ideals of justice, equality, and of being an egalitarian to the next generation or generations, we will be successful as a people. We will be successful as individuals. We will be successful as a movement. I am a clinical associate professor in ethnic studies at the University of Colorado, Denver. I also hold a secondary appointment in the Colorado School of Public Health in Community and Behavioral Health. I first met Dr. Licona in 2000 when he was invited to collaborate with myself and other scientific and community partners for a Special Populations Network grant funded by the National Cancer Institute. I've considered Dr. Licona a mentor and role model ever since. In this documentary, which highlights the Community Health Centers movement through Dr. Licona's work, Dr. Licona eloquently outlines 4 important points that I see as cornerstones of the Community Health Centers movement. They also happen to overlap with known strategies for addressing health disparities among the medically underserved. These are: firstly, recognizing the Community Health Centers movement is rooted in social justice movements, like the Civil Rights Movement and the Chicano Movement of the 1960s. Secondly, recognizing the value of community-oriented care. That is to say, the Community Health Centers care model is a participatory one in which patients and their community plays an active role. This is a worthwhile and effective tool for addressing the needs of the community in a way that is respectful and honors the dignity of community members. As a community member once said, "Nothing about us without us." Thirdly, Dr. Licona emphasizes the importance of the Community Health Center's goal of increasing access to care for the historically underserved, that is, ethnic minority populations, rural populations, and the poor. Lastly, Dr. Licona, through his own example, highlights the need for increased diversity in the healthcare workforce. The documentary also focuses on inspirational examples of others. A discussion of health social justice may explore how social justice in health is defined, and what are the underlying assumptions and values in social justice for health. One approach may be to explore guiding principles for medicine and public health. Avoiding harm and maximizing benefits are just 2 examples of guiding principles and underlying assumptions for medicine and public health. Community-oriented primary care practice provides accessible, comprehensive, coordinated healthcare services for patients in a defined community. This may be a geographic or social community, or it may be persons enrolled in a common health plan. A community-oriented healthcare practice carries the ethic of service to drive community improvement. This includes the principle that community is involved in the design and implementation of the community-oriented healthcare experience. Certainly, one of the key goals of community health centers is increased access and use of healthcare within its target community. We know the disparity statistics regarding healthcare access and use among ethnic minority populations, rural populations, and the poor. To address these disparities, it's important to understand the socioeconomic factors, both within the larger social context and within healthcare systems, that impact healthcare access and use. Equally important is understanding the unique psychosocial patient factors that contribute to a patient's decision to access the healthcare system. Anderson's model for healthcare use is often used to dissect the factors behind access and use statistics. Current projections predict that nearly half of the U.S. population will be made up of ethnic racial minorities by 2050. Many of the groups that will experience the largest growth are also groups that experience large disparities in healthcare. Currently in 2016, the nation's healthcare professionals do not reflect the diversity of the populations in which they serve. African Americans comprise 13% of the U.S. population, but only 8% of medical school applicants. Latinos comprise 17% of the population, but only 6% of medical school applicants. Asian American applicants are overrepresented in medical school applications, comprising an estimated 6% of the U.S. population and 19% of medical school applicants. However, it's important to understand that Asian Americans includes 49 different ethnic groups, and some, like those from Southeast Asian countries, are actually underrepresented among medical school applicants. This documentary provides a tremendous opportunity to honor Dr. Licona's legacy. For those already working in community health centers, it's a catalyst for reflection, discussion, and inspiration, and a learning tool for the next generation of professional healthcare workers in passion to join the community health centers movement.